welcome to my YouTube channel. Today we are going to discuss about a new condition, hypocalcemia. Okay, we see definition. Hypocalcemia means in our blood to calcium, because in our blood calcium level is too little. That is called hypocalcemia. Hypocalcemia is essential for your body to function normally. Calcium, without calcium in our body function normally not happen. So in our body calcium is very important element. And hypocalcemia can be caused by certain genetic factors or due to other deficiencies or condition. It is caused by hypocalcemia caused by some of the genetic factor or due to other deficiencies. For example, vitamin D deficiencies or other condition. In kidney related disease or endocrine problems. This is to affect the hypocalcemia. And normal values ranges from 8.5 to 10.2 milligram per dl. Normal amount of calcium in our blood 8.5 to 10.2 milligram per dl or 2.13 to 2.55 millimole per liter. Okay, the second slide we can see functions of calcium. Okay, calcium is most important minerals for the human body. Human body, it is a very important minerals in our body. Calcium help form and maintain healthy teeth and bones. Okay, it is also help healthy teeth for teeth smooth function and bones. A proper level of calcium over lifetime can help prevent osteoporosis. Okay, it is to prevent the osteoporosis. Calcium deficiency leads to osteoporosis. Second, building strong bones and teeth. Clotting blood clotting, it is very important. It is help to very important element. It's sending and receiving nerve signal. It will help to nerve signals and squeezing and relaxing muscles and releasing hormone and other chemicals. Some of the hormone releasing it is helping and keeping a normal heart beat. These are the important functions of calcium. And causes. What is the main causes of hypothyroidism? The first cause is hypoparathyroidism. Hypoparathyroidism means in our body the parathyroid gland located in the near the thyroid gland in the back of the neck. There is 4 parathyroid gland in our body and it is secreting the hormone is called parathyroid hormone. Its main function which regulates and amount of calcium in our body. Regulate calcium in our body. If for an example in our blood calcium level is too low and parathyroid hormone act as increased calcium in our blood. Okay. And second is a pseudo-hypoparathyroidism. This is also one of the genetic disorder and body cannot react to the PTH. PTH hormone is not reacting and this is causing this disorder causes to make too little calcium and which sends your body into hypocalcemia. That is called pseudo-hypoparathyroidism. The next is very important points. Vitamin D deficiencies. Vitamin D deficiency is a steroid hormone which helps to maintain normal calcium levels. Lower amount of vitamin D makes your body calcium absorption levels drops. This usually happens if you are malnourished or do have enough sun exposure in your life. Vitamin D is a steroid hormone. This is a very important element for absorption of calcium. But in some conditions, if vitamin deficiencies occur, some malnourished and enough sun exposure in our life, sunlight not exposure, that is also one of the causes for vitamin D deficiency. And next is kidney issues and kidney failure. Kidney failure patients also the hypocalcemia occur because vitamin D activate in kidney. That's why in kidney issues patients hypocalcemia occur. And next one is calcium deficiencies. Calcium deficiencies in our body enough consume calcium food if not eating, that is also one of the reason for the hypocalcemia. Or other disorder, maybe some disorder not absorbing calcium in our body, that is also reason for the hypocalcemia. The next condition is causes is pancreatitis. If your pancreas is become inflamed, the new researcher has found often body's protective response to pancreatitis cause hypocalcemia. And next is certain medication. Certain medication drugs like rifampicin, antibiotic, anti-phenytoin, anticonvulsant drug, and phenobarbital, anti-seizure drug. These are the medications. If we are using, we can occur hypocalcemia. Additionally, medicine that fight bone cancers and bone issues are also linked with hypocalcemia. Bone cancer medicines are also using reason for the hypocalcemia. As for an example, alendronate, ibandronate, racindronate, and zoledronic acid. These are the drug for using the bone cancers. This drug is also reason for the hypocalcemia. The next is very important. This diagram is very important. The vitamin D synthesis in our body, because calcium and vitamin D is linked, because vitamin D deficiency leads to hypocalcemia, and vitamin D is helpful for the to absorbing the calcium. So you must know about the vitamin D synthesis in our. Then skin. In our skin present in 7-dehydrocholesterol. 7-dehydrocholesterol, it is a product of synthesis of cholesterol. The synthesis of cholesterol, the product is called 7-dehydrocholesterol. It is present in the skin. Then skin, the exposure to sunlight, this 7-dehydrocholesterol converted into the cholecalciferol or inactive vitamin D3. Then after that, this vitamin D3 converted into the liver. Okay, this vitamin D3 or other product is the vitamin D3 present in the fish meat and vitamin D supplement. These also converted into the vitamin D3. Then this vitamin D3 to convert it to the liver to form the 25-dihydrocalciferol. 25 dihydroxy vitamin D3. And after that, then 25 dihydroxy vitamin D3 converted into the kidney to form the 125 dihydroxy vitamin D3. This is called correct active form of the vitamin D. This is called active form of the vitamin D. This main function: bone metabolism, intestinal calcium absorption, renal calcium reabsorption, blood pressure, and insulin secretion. Okay. Then other function is autocrine and paracrine action. That is function: cell proliferation, cell differentiation, and immune regulation. This is also one of the simple diagram. That is also already I explained. Sunlight in our skin present in the 7-dehydroxy cholesterol. Then 7-dehydroxy cholesterol converted with the help of the sunlight, it is converted into the cholecalciferol or inactive vitamin D3. Then it will go to the liver. The liver, this product converted into the 25 hydroxy vitamin D3. Then finally this 25 dihydroxy vitamin D3 converted by kidney, that is 125 dihydroxy vitamin D3. This is the active form of the vitamin D. That is to maintain calcium balance in our body. And next is in our body, calcium or parathyroid gland and calcium homeostasis. This is the main function: calcium. A thyroid gland, this is called parathyroid gland. Parathyroid gland secrete the hormone is called parathyroid hormone. It is acting into the kidney. Then kidney to make increase calcium reabsorption, and also this kidney activate vitamin D, then intestinal calcium absorption. Understand this? Then next, the parathyroid hormone activate bone, then release calcium. Then in our blood more amount of the calcium is present. These are the main functions of the parathyroid hormone and calcium homeostasis. Simple. Parathyroid hormone activate kidney, then kidney also activate vitamin D function, small intestine calcium reabsorption, and increased calcium reabsorption in kidney. Then bone, parathyroid hormone activate the bone, then release the bone calcium, then in our blood calcium level increase. Okay. The next, the symptoms of hypocalcemia: mainly twitching in our hands, face and feet, numbness, tingling, depression, memory loss, scaly skin, changes in the nails, rough hair texture, cramps, seizure, abnormal heartbeats. These are the main symptoms of hypocalcemia: twitching, numbness, tingling, cramps, seizure. These are the memory loss. These are the main abnormal heartbeat. These are the main symptoms of hypocalcemia. Then one of the important symptoms is, other important symptom is tetany. Tetany is a condition marked by intermittent muscular spasm caused by malfunction of the parathyroid gland and consequent deficiency of calcium. muscular spasm, intermittent muscular spasm, that is called tetany. Then ECG mainly is a normal ECG. The second hypercalcemia, that is called shortened QT interval, but hypocalcemia is prolonged QT interval. Prolonged QT interval seen in the hypocalcemia. And the next main important point is Jostic sign. Jostic sign means contraction of the ipsilateral facial muscles elicited by tapping the facial nerve just anterior to the ear. Response: twitching of the lip to spasm of all facial muscle. When your hand touching the or tapping the facial nerve, say just anterior to the ear, tapping the facial muscle, then it will be to form the contraction. The diagram you can see, when you tapping the facial nerve, the patient is lips to see the contraction or twitching of the lip to spasm of all facial muscle. This is called Jostic sign. The next is Trousseau's sign. Trousseau's signs means induction of carpal spasm by inflation of sphygmomanometer above systolic BP for 3 minutes. This is carpal spasm is a main features of hypocalcemia. This diagram you can see carpal spasm characterized by the adduction of the limb, thumb, flexion of the metacarpal joints, extension of the interphalangeal joints, and flexion of the wrist. Mainly you can see adduction of the thumb. So the adduction of thumb, flexion of the metacarpal joint. These are the flexion of the metacarpal joint and the extension of interphalangeal joint. So the extension of interphalangeal joints and flexion of wrist. That is called flexion of wrist. These are called Trousseau's sign. The management or treatment. Calcium gluconate is a main management of hypocalcemia. 25 to 100 milligram per kg IV. Calcium chloride 10 to 20 mg per kg IV must be given centrally. It is a giving. Treat low magnesium, treat underlying disease. And symptomatic hypocalcemia or calcium less than 1.29 millimole per liter with unknown cause. For control over minutes to hours, IV calcium gluconate 10 millis 10% or 10 minutes 310. That is given for IV calcium gluconate 10 milli 10% of solution or 10 minutes. This if persistent of recurrent infusion of calcium gluconate, adjust rate every 4 hours as required. Adjust this infusion to adjust every 4 hours as required. For control over days to week if indicated, vitamin D treatment and parathyroid deficient vitamin D analog, start dose 0.5 to 1, and can be increased every 4 to 7 days. And PTH intact cholecalciferol for ergocalciferol, and as typical dose 50,000 IU per week, orally for 8 weeks. These are the main points for hypocalcemia. Thank you.